Hi, my name is Heather Ramos, and I will be performing the hand washing and sterile gloving skills videos today. I'm in my school uniform, my badge, and I have no facial piercings. My hands have no jewelry and no watch. I have no acrylic nails, no nail polish on my hands. So before I begin the procedure, I would check the patient's chart to make sure that they don't have a latex allergy for the procedure. I would get my supplies. Now, this bag has been opened. I've been needing to practice. So in real world situation, this bag would not be opened, and I would have to inspect it to check the integrity of the contents inside to make sure that they're still sterile. So I would check the surrounding of the package. Okay, I would make sure that there's no punctures. I'd make sure that it's not damaged in any way or wet. Damaged or wet in any way. Okay, so the bag looks good, and I'll set it aside. Okay, before I begin my hand washing, I want to make sure that I'm a good distance away from the sink, so that way the backsplash of the water doesn't get on my uniform. I want to inspect my hands to make sure there's no cuts or wounds. It looks good. So I'm going to turn on the faucet. I'm going to turn it on to warm, but not hot, not cold, warm. And I want to make sure that the flow of the water is not too strong as it would, splash onto you. Okay, so I'm going to wet my hands. Good. And I'm going to get 3 to 5 milliliters of soap. I'm going to keep my fingertips down in the sink. And then you're going to wash your hands for at least 15 to 20 seconds. Scrubbing on the inside of your hands. The back of your hands as well. Interlace the fingers. Okay. You also want to scrub and clean underneath your fingernails because microorganisms can live underneath there. You want to get those guys out. All right. Nails. They should be about half a centimeter in length. You don't want them too long. Okay. So now I'm going to rinse off my hands from my wrist down to my fingertips. So let the water flow from my wrist to my fingertips. Now, if you accidentally bump your hand against the faucet, you gotta wash your hands all over again. Don't flick your wrists. No flicking of the wrists. You don't want to get water everywhere. Okay, I have a paper towel to the right of me, and to the left of me, I have a garbage can. So I pick up my paper towel, dry off my hand. Pat my fingertips up to my palm. Fingertips. Okay, I'm going to discard. Another paper towel. Make sure that they're dry on the inside of my fingers. All right, discard. Last paper towel, I'm going to turn off the faucet with. Avoid touching your fingers. Go ahead, discard. Okay, so I'm going to have to turn the computer camera so that way you can see my table to the next to me here. Okay. So flat level surface, clean and dry. We have our sterile gloves package. Now the way that you would open it, there's the seam here that you pull apart. Okay. You take the contents out. Set aside. You would discard this. I have to keep it when you keep all the supplies. So set that aside. Okay. You're going to open this up. And make sure that it's facing you. There's an arrow pointing down. Okay. So there is a 1-inch barrier or border around the edge, and that's the only place that you can touch. Okay, you lay it open flat. Now I have my right hand and my left hand. So I'm going to start with my non-dominant hand for my dominant hand, and you're going to pinch the outer cuff of the glove. Pick it up like this, see? Okay. Now, dominant hand is going to go inside the glove. Okay. Take these 3 fingers here, and you're going to go underneath like this to pick up the other glove. Okay. Now your left hand, or my non-dominant hand, which is my left hand, is going to go in. Okay. Now interlace the fingers to ensure that they are tight to your skin. When you do a sterile procedure, you're going to have your hands above your waist. You're never going to fall down, so you're going to do your sterile procedure. Now, done with sterile procedure, you got to take the gloves off. So you're going to pinch from the inside of the palm, and you're going to pull it inside out. Crumple it up in the other hand. Take your finger, and you're going to go from the inside, pull it out. Discard. I got to keep these supplies, but you would discard in real life. Okay. Now, perform hand hygiene, because you want to get all the contaminants and powder off your hands. I'm going to pretend my soap is hand sanitizer. Okay. Let it dry. Then you're going to document in the patient's chart what you did.